Good evening, everyone.
Good evening.
Thank you for coming to our first Conversations on Care for the year. Tonight, our topic is understanding healthcare costs and your hospital bill. My name is Ania John. I'm the Public Information Officer, and I'll be facilitating part of the discussions tonight. Thank you for joining the live. Thank you for coming in person, and I'll turn it over to CEO Baptiste for some opening remarks on our topic today.
Well, a pleasant good evening to everyone. Wishing you a very happy evening. I look forward to our discussion today on this very important topic and, of course, engaging with our community overall. As we look at one system stronger together, we understand that healthcare financing and healthcare economics is truly an integral part of what we do. Moving forward into the integration between Schneider Regional Medical Center and the Governor F. Louis Hospital, my apologies. We take into account our strategic pillars. Our mission and vision has changed, but our strategic pillars still rise to the occasion of having financial sustainability. And that's where everyone could take part in our journey in making this one system much stronger. So I look forward to our dialogue this evening. We'll be sharing with you some really great information. And again, everyone has opportunity to be part of our one system growing stronger. Every dollar counts, but we can't do it without you. So thank you so much for coming this evening, and we look forward to a great dialogue.
Okay, moving along, our presentation this evening will be done by Ms. Lisa Hanley, our Manager of Patient Accounts, and she'll take it over from here. Welcome. Good evening, everyone. So I want to welcome you to our conversation on Community Care Town Hall. My name again is Lisa Hanley. I am the Manager of Patient Accounts, and I am so glad that you are here with us today, or even listening in with us today. So I want to talk about, of course, understanding our bills and healthcare costs as well. So here's what we hope to accomplish today together. By the end of the conversation, we want to improve your understanding of how healthcare cost and medical billing actually works. Explain the connection between patient payments and the hospital ability to keep its doors open and serve its community. Then also to encourage engagement, because this is a two-way relationship, and your role matters as a community. Build trust by being transparent about where we are, what we're doing to improve, and how we can support you. So before we dive into the billing process, our GFL financial reality process, it's important to be honest with you about the financial environment, about our how we operate in healthcare. Like many hospitals, especially those serving island communities, GFL faces real pressures. We're dealing with delayed or reduced payments and increased supply costs, among other challenges. But here's what we want you to take away from this slide, which is understand how healthcare billing works, and we work together, strengthen both your financial health and GFL's ability to serve this community. We're in this together. Next slide. So, does this billing process actually work? It helps to think that it as a connected system, we want to call this the revenue cycle process. Okay, yes. There are three key players in this system. GFL Hospital, we provide care and submit claims. Insurance companies, they review and pay portion of your bill based on your coverage. You, the patient, you're responsible for any remaining balances after insurance pays its share. When each part of the system works well, things run smoothly. When any links breaks down, that's when confusion or delays can happen. We'll talk more about it in the next slide as well. Next slide. Our most common challenges. Again, why billing can be confusing. So it's a fair question, and you're not the only one asking it. Here are some of the most common reasons billing can be difficult to navigate. Missing or incorrect information. A small data error can cause big delays. Insurance delays or denials. Sometimes insurers push back on claims, even valid ones. Prior authorizations. Certain services require approval before care is provided, and if that step is missed, it can affect payments. Bills that are hard to read. Medical billing language can feel like a foreign language, greatly as a foreign language. Then uncertainty about what you owe and why. This is one of the most frustrating experience of patients and we hear that as well. We acknowledge these challenges and we're actively working to address them. Next slide. So basically, our key message that we want to give. Even a simple bill could raise questions. So when bills are more complex, it's completely understandable how confusion or uncertainty can come into play. That's why two-way communication is so essential. When patients don't pay their bills, it's usually not because they don't want to. More often, it's because of confusion, affordability concerns, or simply not having the right information. Our response to that isn't to be punitive, it's to focus on education and support. We want to meet you where you are met. Next slide. Which brings us to something we really want you to know about. We have resources to help you. JFL offers several financial assistance programs. We have Charity Care. That's if you qualify for your if you qualify, your hospital charges can be reduced or even fully waived. Our financial counselors are available to walk you through your application process. We have interest-free payments plans. We offer flexible payment options, both short and long term, so you can manage your balance in a way that works for you and your budget. We have CareCredit financing. That is basically a specialized credit option for healthcare expenses. It covers out-of-pocket costs and offers flexible financing, including promotional interest-free option if paid within a set time frame. It can be used for medical, dental, vision, and other healthcare-related expenses. So once again, please don't let your bill sit unanswered. We are here to help you as a billing department. Next slide. So I want to talk about our responsibility within our department. So we also want to be transparent about our responsibility in improving this process. JFL has partnered with First Source, that's a revenue cycle expert agency, to help us strengthen our operations from the inside out. The partnership focuses on improving billing accuracy and consistency, strengthening documentation and coding practices, enhancing our systems and workflows. What does this mean for you? More accurate bills, fewer delays, clearer communication, and an improved overall experience. This partnership isn't just about finances. It's about doing things the right way so we can better support both our patients and the long-term health of this facility. Next slide, please. So how to reach us? Right now, we are located in room 2, VICC room 2. And if you have any questions about your bill, we are open Monday to Friday, 8 to 5. And we have a telephone number, which is 340-778-6311. And you can also visit us at www.jflusvi.org. There is a specific tab that's called financial services, where you can also inquire about your medical records as well. Yeah. And that's my presentation for tonight. Anyone has any further question, I'll open the floor. Yes, sir.
So I just got 3 quick questions. So I come and I break a leg and I'm treated 1 a week. But then I go to St. Thomas, I break the other leg. Is it one billing or do they get a different bill?
It'd be 2 bills.
2 different bills?
Yes.
Is there plans to integrate that so I'm not getting multiple pieces of paper?
Not right now. We are both operating on different systems. We have different procedures, different operations, different services. So that section of the bill will remain separate. So once you receive a bill from JFL, you will make your payment at JFL. If your injury occurs in St. Thomas, then same would apply.
Is that going to change, Madam CEO? I mean, we've got one CEO, multiple bills just add more issues of people. Are we going to have integrated billing so that there's one bill so everybody knows? I mean, it may say where you were treated,
Yeah.
but and I'll give you an example. I'm treated at the University of Connecticut Health Center in Farmington, but I go see the doctor stores. I get 1 bill. They know that they're telling you this is your bill. It's on one website. I'm asking, are we not integrating all this? Was not this the reason we have one CEO? Because I'm just asking questions I know the public's gonna ask.
Yeah. I'll just I'll leave it for the CEO.
I'm not trying to, by the way, this is great. I've never been to a place where they explain the bill. This is fantastic. I'm not throwing shade at you. I'm just asking.
You're just asking?
Trust me, I'm gonna ask because somebody else is gonna ask.
Okay.
Who may not be as nice.
No, I appreciate the question and great point. We are integrated into one system, but right now, by virtue of us having separate tax IDs numbers,
Right.
we're actually going to have to work through the legislation. Once the legislation is established into one system, then we'll be able to start integrating our services, not just the X-ray, but all services across both facilities.
Oh, my next question, just want to ask, I had 3 quick questions.
You said 3, yeah.
Pretty long. Okay, so your charitable area, I will sort of, and when did you explain about the charitable giving? Only if there's a dispute or somebody says they can't afford it? Is it done on the beginning or the end? How does somebody know? I come in the emergency room and I really don't care about the bill at that point.
So
Others, but I don't.
you want to take
How is that handled at
this
that
is
point?
the manager of patient access.
Okay.
He will
Okay.
explain a little bit.
Good evening, and thank you for your question. My name is Freddie Pimentel Jr. I'm the manager of patient access. The financial counselors are my responsibility. So that's part of the financial counseling process. So to answer your question, when is that
Yeah.
presented? That would be after, because that's not something that we present up front. We give everyone the opportunity to take care of their service, take care of their bills on their own. This is
Okay.
something that you determine after the fact that we found that you're not able to meet all your financial obligations. So this is something that will help you on the back end. So once you've received your bill, you come to us with that information, and then we'll put you through the qualification process based on the charity care program.
Okay.
Number 3.
No, I think I'm gonna drop the number 3.
Okay.
That was really good.
Absolutely. Any other
Any
questions?
other questions?
Yes.
the extension for people to call rather than going through all the,
So for, if you want the financial counseling department, the extension, you dial the number 778-6311, and then you dial extension 2198. Or if you like, just dial the operator and ask for financial counseling and or any other billing services within the billing department.
Yes.
Are they gonna have any amnesty programs?
Not right now that I'm aware of. We've been asked this question multiple times, but for right now, the situation that we're going through, trying to recover from cyber attack, yes, that's table for future discussion.
I believe we had an amnesty program for vendors, approximately 3 years ago. And it was not a great success. A lot of people didn't take advantage of it. So now that we have all these things going on, we wanna get out of that hold first before we talk about amnesty again.
Was it not a success because nobody knew about it, or?
I think I was not on in-house at the time, but I think it was rather well publicized.
Because, the government has an amnesty program on taxes, and I'm amazed at how many people don't know about it. Until they go to revenue service and, you don't have to make a bill, what do you mean? Okay.
Any more questions? I know we had some latecomers that just arrived. Any questions from you? Just listening.
So for those who are here visiting, we do have, if there's any questions about your bills that you may have, we do have services readily available for you to review your accounts. If you need further assistance with payment plans, anything to that extent, next door is open for any queries or inquiries. Okay. And with that said, thank you very much for listening.
Good.
Thank you.
All right, thank you, Lisa, thank you, Freddie, Ms. Javois as well. Just to cover how we're doing these town halls. The intent is to do it quarterly. We may increase the frequency, but these are some of the topics that you can expect. Today we covered our financial education, and that covers our financial sustainability strategic pillar. Next, we could look forward to emergency department education, understanding the process, knowing before you go to the ER, understanding how that works. And then we'll move on to get to know JFL. What services do we offer? A lot of people aren't aware of a lot of things that we offer here at JFL. So that topic would encompass all those services, whether outpatient and inpatient. And then a very hot topic is the future of JFL. We'll touch on where we're at with the demolition and the rebuild, and giving great conversation and insight on what the future of JFL will look like. And then towards the end of the year, then we'll look at patient experience. Okay. And that's about it for our town hall today. You can stay connected with us on Facebook, Instagram, everywhere at JFL USVI. You could share if you have any recommended topics that we should cover that the community would be interested in learning about. From an education perspective, you could always send that to me at ajohn@jflusbi.org, or you can send it to the info email at info@jflusbi.org. And that's it.
Great.